Vaccination cannot be questioned.
We need debates on the subject. At this time, there should be a public debate on vaccination.
Vaccination cannot be questioned.
We need debates on the subject. At this time, there should be a public debate on vaccination.
Vaccination cannot be questioned.
We need debates on the subject.
Vaccination cannot be questioned.
We need debates on the subject. At this time, there should be a public debate on vaccination.
Vaccination cannot be questioned.
She just speak. Everybody can speak, and everybody can believe in God. This is not science. It's just belief and religion.
Évidemment que ça se discute.
Obviously, you can question vaccination. The hostility of part of the scientific community to the research Gherardi and Authier have done is due to a fear anti-vaccination leagues will form. But let's be reasonable. An adjuvant is not a vaccine. Questioning a vaccine doesn't mean you oppose vaccination itself. That's an important detail in the analysis of this issue. I also think that some people have instrumentalized the debate, using a straw man strategy. If you can make a mockery of your opponent's ideas, it's easier to contradict him.
It all started with pains in my left leg, a kind of chronic sciatica. It mainly affected the lower part of my body, the lumbar region. It was so painful I couldn't stand to be touched. I was so sensitive there. Any pressure was excruciating. I had major problems with sensitivity. Then it spread to my upper back. I felt like my muscles were torn as if I'd been beaten all over my back. Then it spread to my right leg. And then it continued with my upper body, my shoulders. It was a burning pain, as if the joint were inflamed. The pains would course down through my arms, all the way to my fingers, like electric shocks. My neck muscles were also really sore. I often had to wear a neck brace, yes. Sometimes it was hard for me to walk. I would limp. That went on for quite a while. I saw several doctors, GPs, physical therapists, even osteopaths. We didn't know where to turn. I underwent various examinations, CT and MRI scans, blood tests. They found nothing.
Then the going gets tough. You go from doctor to doctor, having exams and blood work done, and no one can find what's wrong with you. You hurt all the time, and worse yet, your pain keeps increasing. And how can I say it? The pains keep spreading throughout your body. First, there was the back pain. Then your knees start to hurt. When I walk, my knees tingle, things like that. It gets worse day by day. But there's not one doctor who can name the pathology. Finally, in the end, they send you to a psychologist. There was even one doctor who told me his divorce had done miracles for him. That's all they can conclude.
When I was searching for a diagnosis, seeing doctors, whether they were rheumatologists, GPs, neurologists, or whatever, they kept telling me it must be psychosomatic. I almost started to believe the pain was my imagination. Many of the patients who contact us report suffering from this feeling. It's really a case of medical maltreatment. If they can't identify the pathology, they chalk it up to mental illness. But I'd been telling my friends at work what was happening. My coworkers are sympathetic. It helped a lot when someone connected me to another patient, a friend of a coworker. She recommended Henry Mondor Hospital. I got an appointment there, and the doctor prescribed a biopsy. The biopsy of the deltoid muscle revealed I had macrophagic myofasciitis. My primary care physician was the one who received the biopsy report, and it was she who told me I had MMF. She was happy for me. A diagnosis had finally been found. I had been waiting so long and suffering so much. I broke down crying when I learned my disease had a name. Talking about it brings back unpleasant memories.
Natalie was the first person who mentioned a disease that could have been caused by the vaccines.
The last time I was vaccinated, it was for hepatitis B and diphtheria, tetanus, polio, using Genevac B and Rivaxis. They allegedly triggered this pathology.
When I was finally diagnosed with macrophagic myofasciitis and found out the vaccination was the source of my problems, I'd been sick for 7 years. 7 years of wandering from doctor to doctor.
It's totem and taboo. The vaccine is a totem. France is Louis Pasteur's homeland. Personally, I am convinced that the history of vaccination has provided ample proof that vaccination is extremely helpful to the world's public health. I agree with most of my colleagues that it is a treasure to have vaccines available. So anything that affects vaccination is a problem. But on the other hand, it is also true that as a doctor who has seen a cluster of patients with this syndrome, you can't just forget about it. You walk a narrow line between wanting to maintain the public health benefits of a vaccine and your refusal to be guilty of an injustice, an unforgivable unfairness to patients who have undesirable side effects.
These patients are unwell. They have serious illness. It disables them. The fact is always underestimated. These patients have severe symptoms of disease. Pain, intense weariness, cognitive disorders. And nevertheless, they don't seem to have, to the medical profession at least, they don't seem to have a disease. Doctors don't understand, and when a doctor does not understand, he tends to say it is psychosomatic to simplify matters. But it isn't. These patients are already in pain. It's hard to diagnose the cause. Once a diagnosis has been reached, the doctors who made this diagnosis will say they do not know enough about the disease to treat it. Go to Henry Mondor Hospital in Créteil. At Henry Mondor, it's easy for us to refer to the database. For the number of patients we are treating, 335 to date. The number of patients who have been diagnosed since we saw the first cases is larger. There must be around 500 or 600. And of course, that represents the activity of only one center. To the best of my knowledge, we do not have any active national register or observatory for this disease, able to give us the exact figures. If we base ourselves on the fact that when we look at the number of vaccinated patients who have a chronic fatigue syndrome with muscle and joint pain, we come up with an average after our evaluation procedure of 1/3 with macrophagic myofasciitis. It is possible to estimate there are several thousand, say 10,000 patients in France who may have MMF. That is a large population, and it is certainly a conservative estimate.
I've been ill since 1994. I was diagnosed in 1999. I joined E3M, an advocacy group for MMF patients, in 2002. I joined E3M because they were on the right track. Patricia Basley and her husband Georges were then chairing the group. They had oriented the organization's activities toward scientific research, based on the principle that knowledge alone was the key to blaming aluminum salts in vaccine for our illness. Starting in 2011, because we were backed by enough scientific proof, we contacted French lawmakers. In fact, 260 of them to date have intervened on our behalf with the health ministry regarding aluminum in vaccines. During the 2012 presidential campaign, we contacted every candidate, regardless of party. Some of them made promises. François Hollande and his aide Marisol Touraine promised funding for research and access to aluminum-free vaccines for the general public. In 2013, once Hollande and his team were elected, we realized they wouldn't honor their promises. That's when, as chairman of E3M, my team began to hold politicians accountable, staging protests at the health ministry.
The story started in 1993 at a yearly meeting of the French Neuropathology Society. My colleague from Bordeaux, Michèle Coquet, presented a clinical case. Every year, the neuropathologists described bizarre cases to see if anybody else has encountered something similar. Michèle told us about the case of a nurse from Jonzac. Her symptoms were muscle pain, a mysterious lack of energy, and elevated levels of muscle enzymes in her blood. Muscle biopsy showed an unusual lesion filled with macrophages. Dr. Coquet is an electron microscope specialist. She had studied the lesion under a powerful microscope. She found particles inside the macrophage cells. No one at the table had seen comparable lesions. Dr. Coquet's observations were largely ignored. The literature is full of rare, mysterious phenomena like that. A few weeks later, here at Henry Mondor, I had a biopsy from a patient who also complained of muscle pain and fatigue. He also had high muscle enzyme levels, so he too had undergone a muscle biopsy. Looking at the biopsy results, I found a lesion, identical to the one Michèle Coquet showed us.
This was a patient who presented a panel of symptoms we later identified as characteristic of MMF. It was the first such biopsy we'd seen at Henry Mondor. We examined these lesions at length because they were new to us.
Michèle Coquet is a person who really knows how to follow up on an idea. She had sent a muscle fragment to a physics lab in Bordeaux. Nearly all of us had forgotten about the particle inclusions. We were actively searching for the bacteria causing this new disease. The lab reported back to us that the tissues contained aluminum. On the basis of this finding, which was extremely surprising, we rushed to the patient's histories, but we couldn't find any history of aluminum exposure. Fortunately, since the patients we'd biopsied had minor autoimmune anomalies, I had ordered Roet's 4-volume Dictionary of Immunity. It is the immunologist's Bible worldwide. A few days after we'd received the lab test showing traces of aluminum, I got my 4-volume Roet. I decided to look up the effects of aluminum on immunity, even though I lacked the source of exposure. Perhaps aluminum played a role in autoimmune diseases? And in the index, I found a reference to aluminum as a vaccine adjuvant. Fortunately, in France, patients keep vaccination records. It was tough detective work. For some patients, we had to contact the GP to look it up in its own files. But we hit the jackpot. 100% of our MMF patients had been vaccinated. It often dated back months or years before symptom onset. That's how we gradually connected the dots. Finally, we were certain that the MMF lesions observed under the microscope were actually proof of the persistence over a very long term of the aluminum hydroxide adjuvant that has long been used to make vaccines.
Macrophagic myofasciitis must be clearly defined. We are talking about patients who have histological MMF lesions for unusually long periods of time. That's important to note. The histological lesion we see in the biopsy corresponds to what we call the post-vaccinal granuloma. This granuloma occurs in anyone who receives a vaccination containing aluminum. It is a physiological phenomenon. However, the amount of time the lesion persists is not known precisely in humans. But we do know, on the basis of lab work with rats in particular, that the lesion shrinks as time goes on. It disappears within the year following the injection. A lesion in a patient 4, 5, or 6 years after a vaccination is an abnormally long persistence.
We had to check to see if all of the patients had a coherent panel of symptoms. To do so, we had to set up a clinic to track these patients. My assistant, Dr. Jerome Authier, who is now a professor, set up this clinic at Henry Mondor. A similar clinic was set up in Paris at La Pitié-Salpêtrière Hospital. It was supervised by Dr. Sharon. These two clinics enabled us to observe that all patients whose biopsies showed macrophagic myofasciitis, the lesions containing aluminum salts, presented the same clinical symptoms. Taken together, about 90% complained of muscle pains. About 50% complained of pains in the joints. They also presented fatigue, which we soon identified as a major component in the panel of symptoms. It was present in 80 or 90% of these patients. They also complained of cognitive disorders. Patients told us, "I'm not as sharp as I used to be."
I managed to live with it, more or less. But when I was at work, I realized something was seriously wrong. As an electronics engineer, I needed a good memory. I had to recall lots of details, how devices had been modified. When I picked up a screwdriver to open a device, my wrist hurt. I had to let go. My hand was too weak to hold the screwdriver. My coworkers couldn't get over it. You used to know all the answers. Now you have to look everything up in the technical specs. That's it. I'd go to work and come home 2 hours later. I was too sick to work. My head hurt. It was clear that I was in bad shape.
In Créteil, we are fortunate to have a center which specializes in studying higher neurological functions. These patients were examined there. A pattern of anomalies emerged fairly clearly. Certain types of memory were impacted in particular. More complex tests showed there was probably an organic lesion in the brain.
Then we have a real photograph of the patient's condition. We can suggest therapeutic strategies. We don't know how effective they are. This illness is very hard to treat.
In 1854, when Henry St. Clair de Velle produced the first metallic aluminum, he studied its chemical properties. Using the scientific resources available at the time, the instruments and so on, he concluded the metal was harmless. He compared it to other metals, like the tin-plated metal, copper, and lead then in use. Aluminum appeared to be the metal of the future, for cooking utensils in any case. By 1886, the cooking utensil market had developed considerably, so some controversies appeared. The first significant challenge was published in 1891. Two German scientists claimed that aluminum was dangerous. They said it could be corroded and dissolve into food. The other controversy is still going on. Surprisingly, the U.S. still debates the safety of its baking powder. There were two rival processes. Baker's yeast is 100% natural, based on a fungus, or a chemical rising agent can be used. The first uses ingredients like sodium bicarbonate. The second process is based on aluminum or aluminum salts. The war between manufacturers went to court, bringing this controversy to light. To settle court cases, manufacturers hired scientists to do research. So some tried to show aluminum was harmless, others that it was toxic. Several hundred researchers were involved in this first great investigation into aluminum's toxicity. One of the particularities of this controversy is that a commission was appointed by Roosevelt in 1908. These chemists and physicians were assigned to judge the metal. There was a lot at stake, actually. Baking powder is a key ingredient for the baked goods industry, then in its early days. Even as early as the 1870s, the food processing industry was being organized. There was a lot of money at stake. Mainly, there was a real controversy. It opposed manufacturers and public researchers. from the U.S. Department of Agriculture and at Columbia University. High economic and scientific stakes were attached to aluminum. Certain researchers published incriminating evidence. This large tome was published by an author who long maintained a following. Ernest Ellsworth Smith was recognized as a scientist. He published this book in 1928, over 30 years after the beginning of the controversy. The book is supposed to weigh all the pros and cons, but it is extremely biased. He picks and chooses what he wants from his sources. He omits any findings that aluminum is harmful, and he concludes with arguments that are not at all scientific. The anti-aluminum side, Smith's opponents, had much less funding and couldn't afford to publish a book like this one. Starting back then, the match was uneven. Both sides had scientists doing serious, legitimate work. But the pro-aluminum group had sponsorship. That often happens with manufacturing even today.
Very often in the history of these relations between science and industry, science has been used to demand incredible levels of proof before making the slightest decision. The amount of scientific evidence required is much greater than that demanded before a product can be marketed. It's interesting. For anything related to biology, it's very difficult to obtain proof when a substance or product is spread among the general public on a large scale. Events may occur, but their incidence might be low. It's very hard to establish a causal relationship. Nevertheless, to obtain what we define as scientific evidence, you often have to wait until you can count the dead and the sick. That's a way of putting science on the wrong track. Nothing in science says that scientific proof should outweigh public health. That's a political choice. I find it interesting to note that in cases with a strong suspicion, or even a moderate suspicion, that a product might damage public health if it is marketed, good science supposedly demands we wait to have definitive proof. Often, that's just impossible. It's impossible, and anyhow, once again, science does not require that scientific proof override public health concerns.
It is just like what happened with the tobacco industry. Doubt was leveraged. The point of these publications is to tell the judges, see, they aren't 100% sure. Some doubt persists. You cannot ban that particular use of aluminum.
Scientific proof is strong and meaningful. It is obtained only partly through toxicology, only partly through mechanisms which explain how a product acts. Epidemiology also counts. That is, the proof that people really are ill. It is very interesting because to obtain epidemiological proof, you need epidemiological studies, and those studies require funding for laboratories and scientists. No funding, no proof, and you'll never get any.
The same thing happened in Britain in the interwar period. A general practitioner published this pamphlet in 1928. It aroused manufacturers' ire, eliciting a hostile response that was carefully coordinated. Rebuttals were published by a renowned scientist and toxicologist. They operated exactly the same way according to the same mechanisms as Ellsworth Smith. Alongside standard scientific arguments, there are borderline assertions. Mainly, the work of a GP was discredited because he seemed less qualified than a professor of medicine.
Note that aluminum hydroxide became available in 1927, the same compound that is used in 2016. It hasn't changed at all. It's as if they're still using the same aircraft as in 1928, when civil aviation first started. As if in 2015, the same Fokkers were being flown. The same Fokker as in 1928. If you saw a picture of that plane, you wouldn't want to board it. It's a valid comparison. This is the same thing. No one wants to give up flying. Air transportation is extremely important in our world. But everyone demands that airplanes continually pass new safety checks. It's the same thing with adjuvants. No one wants to give up vaccination. Vaccines are essential. But the population demands that in the case of vaccination, safety requirements be as stringent as they are for aeronautics. With the most careful attention, I studied all of the literature prior to macrophagic myofasciitis, all of what was known or thought to be known of aluminum adjuvants. It's all wrong. Totally wrong. Everything is wrong because it is fragmentary and incomplete. The study cited as a reference on how the body absorbs the aluminum adjuvant in a vaccine dates from 1997. It was carried out by an American researcher named Flarand. His co-author is Stanley Hem, the Pope of Adjuvants. The work consisted of injecting an aluminum isotope, radioactive aluminum, into 2 rabbits. Only 2 bunnies. These 2 rabbits received intramuscular injections. Scientists then monitored the rate at which the rabbits could eliminate the radioactive aluminum by measuring the levels of aluminum in the rabbit's urine. The result of this test in itself is quite alarming. Elimination 28 days post-injection was 6%. In other words, 94% of the aluminum remained in the animal's body. Despite this study, scientists still claim that it only takes a few weeks to eliminate aluminum injected into humans. Worse, the researchers lost the animal's bones. Bones are known to be one of the sites where the body stores aluminum. So besides using only 2 rabbits, the researchers lost both femurs of both rabbits. Unfortunately, they were destroyed. How silly. The muscle that was injected was not examined. In other words, they couldn't determine whether the injected aluminum stayed there or not. Moreover, we find ourselves with a study lasting only 28 days. Whereas now, there is no doubt that the adjuvant stays in the body for years. This study which says nothing's amiss, very little is absorbed by the brain, perhaps after 28 days. But how about 6 months, a year, or 18 months post-injection? So this is the study that worldwide vaccinology takes as its reference. 2 rabbits whose organs were lost and who were studied for 28 days. The study simply has to be done all over again properly.
Dr. Christopher Exley, who works at Keele University in Great Britain, is one of the world's great experts on aluminum. His peers call him Mr. Aluminum. Every 2 years, he hosts an international conference of specialists in aluminum toxicity from Europe and North America. I've been meeting with him on a regular basis, especially in the past 5 years, either in France or in England. He's one of the world's top experts in the field of aluminum. But he is also accessible, and he wants the public everywhere to be aware that we have entered the aluminum age.
Chris, I wanted to come and see you to speak about your research on aluminum toxicity in Alzheimer problem, in vaccine and in other fields you are working. Mm-hmm. What are now your special research, your results? Where are you now?
Yeah, well, as you know, myself and my group, we've been working in the field of aluminium for more than 30 years now. And that covers a wide range. It covers from the basic chemistry of aluminium and through to the way in which it would interact with any living organism. And that has been our remit for 30 years, which is to understand why aluminium has no biological function. So that's really been what my group set out to do. Most recently, I would say in the last 10 years, our focus has been on what we call human exposure to aluminium. One of the things that my group has always said, we are not anti-aluminium. We absolutely respect the many ways in which aluminium has contributed positively to all of our lives. This is not an issue with us. We're not anti-aluminium. Mm. But whenever you introduce something into life and into, particularly something which is going to be you expose humans to, you would normally make sure that it's safe first. That would be the first thing you do. In fact, for almost everything else you can think of, you have to do that. You have to demonstrate that something is safe first. That has never been necessary for aluminium. It has never been demonstrated that aluminium is safe. No, there's never been any legislation in order to do that. And this is a historical thing. My understanding of aluminium and aluminium in living things and therefore human beings is that while aluminium is the most abundant element on the Earth, in the Earth's crust, for almost all of biochemical evolution, it was excluded from the process because of its interactions primarily with silicon. We've shown that when silicon binds aluminium, it's non-toxic. That's why the Earth and life evolved on an Earth's crust made of aluminium, silicon, and oxygen so successfully, because these three elements were together. Man, only 120, 30 years ago, learned how to take that aluminium, silicon, and oxygen and turn it into aluminium metal and aluminium salts, and heralded the aluminium age. So our Earth, living things on the Earth, and humans primarily we're talking about, have only been experiencing aluminium, biologically reactive aluminium, for 120, 150 years. We are at that stage in evolution when it's toxic. We haven't had the chance for aluminium to be incorporated into anything living and used beneficially. It will happen. But of course, man may die out before that happens.
We have to accept, yes.
Yeah, right now we're just accepting the consequences of taking this very biologically reactive metal, living with it, and accepting what it does without any attempt to protect ourselves from it. And actually, opposite to that, really covering up the damage that we probably know that it does already. So, for example, in the recent EMA, European Medicines Agency review of the HPV vaccine, how many experts on aluminium did they consult? None. So how can they get that aspect if they can not consult anybody? And this happens all of the time, all of the time. We get people who have no knowledge, who are uninformed, sitting on World Health Organization, Food and Drugs, etc. All of these different committees who talk about aluminium. You have this fallacy of, I think it's the World Health Organization, giving a safe limit for aluminium. And they say, as long as it's below 1 milligram per kilogram body weight per day, you're safe. So I ask them, how do you know that when I don't know it? I've been working on aluminium for 30 odd years, trying to understand it. You know this. I asked them for the details. How did you work this out? And who did it? And it's based upon 2 or 3 animal studies taken from the literature. And that's a human recommendation. And the people who reviewed it, none of whom have any expertise in aluminium, and that has become a value that all over the world, people say, the World Health Organization. You know, the one thing I hope is this. I actually, like all of us, rely on people like the World Health Organization. I hope that in everything else other than aluminium, they do consult experts, and they are correct. So when they're telling us about, the levels of certain PCBs or something in the environment, I hope that they're not as wrong as they are with aluminium. Because if they are, then this organization is totally corrupt and useless. But in terms of aluminium, it is. And it always will be until they decide to actually talk to people who know.
The World Health Organization predicts sales reaching $100 billion in 2025. $100 billion per year in vaccine sales. So these are serious matters in industrial and economic terms. Of course, there are scientific experts involved in these questions. In addition to public health, manufacturing and geostrategy are involved. These are complex questions. Apparently, manufacturers have a say in the matter.
You can influence a scientific trial in a number of different ways. The first is to test only a part of the product going on the market. The vaccine without the adjuvants. That's the first way. The second way is simply to purchase your scientists. You can handpick the jury that will ultimately decide whether the product is safe. Again, that is common practice among manufacturers of all kinds, pharma, chemicals, agrochemicals. For example, look at the European Food Safety Authority, the EFSA. If you check the scientific panels in charge of publishing opinions on food safety or nutritional qualities, you realize that an average of 60% of the experts are subject to conflicts of interest. They're on the corporate payroll as consultants or researchers or something else. If they are not independent and objective, the public cannot trust their judgment.
Not one of the experts who has studied the material we have compiled on MMF. And I am speaking of experts in their own capacity. I'm not talking about experts from public agency staff. I really mean independent experts. We've asked to assess our research and give an opinion. Not one of them is free of strong connections to the vaccine industry. That's all I can say. And many experts have looked at it.
They have people that I call the aluminium ambassadors. Yes. Now, their ambassadors are bona fide scientists, usually good scientists, all around the world, who are paid by the aluminium industry to say that aluminium is not a problem. But these are not individuals who work on aluminium. Most of them have absolutely no background in aluminium whatsoever. They are individuals who, for example, work on Alzheimer's disease. And then whenever someone at the Alzheimer's Society, a major charity, asks for advice, they ask this well-known person in Alzheimer's disease, what's the role of aluminium? No, there's nothing to worry about. They don't ask me.
Scientific findings about aluminum adjuvants in vaccines are now extensive and known worldwide. We patients and patient advocacy groups do not understand why legislators are not taking serious action. In order to understand, we checked into the pharmaceutical industry. Sanofi, a French multinational, has a big stake in vaccines. It is the world's largest producer of vaccines. Its majority shareholder is L'Oréal. L'Oréal is the world's largest cosmetics company. L'Oréal's principal shareholders are the Bettencourt family and Nestlé. Nestlé is the world's largest food industry corporation. These three corporations have a special interest in aluminum. Sanofi uses aluminum in vaccines. L'Oréal uses it in cosmetics, and Nestlé in food packaging, infant formula, etc. Note that the people who oppose the research by Drs. Gherardi and Authier are mainly financed by either Sanofi or the Bettencourt Foundation. Is that a coincidence?
Now, the thing about aluminium, and what makes people complacent about aluminium, is that you don't see acute events very often from aluminium. Aluminium is not like cyanide or lead or cadmium. You don't suddenly feel ill and you don't suddenly get ill and die because you've had a single exposure to it. You'd have to have you can, but it would have to be a very high exposure. Aluminium is different. It's this silent visitor. Now, there is a proviso for that, an exception. And I believe the exception to that can be vaccination. And it is clearly not an exception in the vast majority of people, because the vast majority of people receive aluminium adjuvants and do not get severe adverse events. But if it's 1% of people, 1% of millions of people, young women having the HPV vaccine is a huge number of people suffering severe adverse events. These severe adverse events are unquestionably due to the presence of that aluminium compound. Aluminium has this amazing ability to turn the body against things that would normally be considered as self. So that's why, for example, I am not surprised that aluminium could be involved in something like multiple sclerosis. In multiple sclerosis, we know that the body starts to break down its own myelin. It produces antibodies against its own myelin product. Why? Well,
researchers checked for a link between multiple sclerosis and hepatitis B vaccine. An association between the two was found in the studies that looked at the vaccination in the long term and saw a phenomenon. I mean, Hernan's research and Tarot's work on childhood onset MS. It took 3 years for the increase in risk to be visible. In the first few years, it was unobservable. No acute toxicity. When they say the innocuity of these adjuvants has been proven, beware of the semantics. Stop. They are innocuous in the short term. But you can't say that they are innocuous in the long term because you don't know. No studies have been done.
In fact, the adjuvant does not require clinical approval at all. It is the vaccine preparation which requires clinical approval. So you may put any adjuvant into a vaccine, it will then go through a clinical approval process, and if it gets approved with that adjuvant, regardless of what it is, whether it's an aluminium adjuvant or another, then it's the vaccine that will be clinically approved, not the adjuvant. So that was a surprise to me. So I contacted Brenntag, the manufacturers of these adjuvants. I contacted the FDA in the States, and I contacted the European Medicines Agency, and I asked them the question about the clinical approval of aluminium adjuvants. And they all replied in exactly the same way, that no aluminium adjuvants require clinical approval.
The fact that the toxicological study concerns vaccine, not the adjuvant, is a profound question. It applies not only to the pharmaceutical firms, but to the chemicals industry as a whole. There's a simple parallel I find very eloquent. Look at how plant spray toxicity is evaluated. Pesticides, fungicides, insecticides, herbicides, etc., they are evaluated by the manufacturers themselves, seeking to market the product. Moreover, strictly from the regulatory viewpoint, chronic toxicity testing is done only on the active ingredient. There are many adjuvants, because plant sprays also need them to boost efficacy. The many adjuvants used in these sprays are never tested. This introduces an enormous bias into the product testing protocol. The substance everyone is exposed to is never evaluated. I think that's a profound flaw in the regulatory system. If it isn't settled, people will stop getting vaccines. Their trust in the regulatory system will be eroded. It's already happening. The recent EU discussions on the herbicide glyphosate showed that citizens massively demand accountability. Matters that seem to be technicalities, like product regulation or approval, have become political issues, and citizens demand action. For vaccines and for a whole spectrum of products. Testing should involve the product to which people are exposed, not just the active ingredient.
In 2011, Virginie Bell wrote a book, When Aluminum Poisons Us. It's a valuable book that taught us a lot. In particular, as early as 1974, the Pasteur Institute developed calcium phosphate adjuvants to replace aluminum salts in all of its products. Dr. Edgar Reliveld was the inventor of the process. I met him several times thanks to Virginie Bell. Our association, E3M, is the repository of his archives since his death. This is how I learned he had worked extensively with Michèle Thibaudon, who was a pharmacist at the Pasteur Institute. Michèle Thibaudon is one of the people I enjoy meeting. You knew Dr. Reliveld at the Pasteur Institute?
Who didn't know Dr. Reliveld at Pasteur Institute? He worked mainly on vaccines. And at the time, he had already spent some years studying reports of the problems that might be associated with aluminum. That's why he developed the calcium phosphate vaccines. With the Pasteur Institute patent he also created. That was in the 1970s, I'd say.
Were they used by the Pasteur Institute and other agencies?
They were the Pasteur Institute vaccines. The child vaccines marketed by Pasteur Institute.
Were they used in France? In other countries?
They were used wherever Pasteur Institute sold vaccines. all over the world. In the mid-1980s, Pasteur Institute joined with Miro Institute to form Pasteur-Miro serum and vaccines. According to Marc Gherardi, who went from being scientific director at Pasteur to being scientific director at Pasteur-Miro, that is when profit prevailed over public health.
Because aluminum was preferred to calcium phosphate.
Unfortunately, that's what happened.
Dr. Fleuret, president of the Vaccination Technical Committee, admitted that the calcium phosphate adjuvant was no less effective than aluminum hydroxide or aluminum salts. The adjuvant could be brought back. All it takes is a political decision. Then our vaccines would be safer. The Marie-Ange Institute's decision to nix calcium phosphate attracted attention at the time, at Pasteur, of course. Many expressed their disapproval. Doctors also reacted, allergy specialists in particular. Dr. Nicole Donat pleaded with Health Minister Michel Barzac in 1987 to reverse the decision.
Yes, I have my letter. The oldest adjuvant used in vaccines is aluminum hydroxide. It is still used to manufacture Marie-Ange vaccines, even though it has been known for some years. This was in 1987, but it was first suspected in the 1960s, as I told you. The adjuvant has adverse effects. It increases immunoglobulin levels. Immunoglobulin E levels are already too high in allergy patients, so there's no reason to raise them even more. Risk of cerebral neurological disorders after products containing aluminum are injected or after long-term exposure to aluminum dust. If accidents occur in allergic individuals, the health ministry will be or is fully responsible for them. It cannot say it was not alerted. They were definitely forewarned. By Henoch, by Reliveld. The team at Pasteur reacted to the decision, of course. But there was absolutely no response. At the time, I was a consultant at Boucicaut Hospital. I boasted about all of my titles. Listen up, I was a staff member of a well-known pulmonary care unit. But I wasn't a professor, and that was the problem. In France, if you don't have a fancy job title, you can't do much. It takes a huge amount of energy and tenacity to succeed in getting a job done right.
So in 1986, the Marie-Ange Institute decided to eliminate its calcium phosphate vaccine line. But the Marie-Ange Institute also manufactured a vaccine without any adjuvant at all. Sanofi, which bought out the Marie-Ange Institute, decided to get rid of the adjuvant-free vaccine in 2008. In particular, the DTP, diphtheria, tetanus, and polio, which functioned well for 40 years. Doctors and families liked it. 1 million vaccines were sold yearly.
They emphasized the fact that allergic reactions had allegedly been reported. Due to the severity of these reactions, this vaccine was withdrawn from the market. I read the data on the allergic reactions closely. There is no link whatsoever between the allergic effects and the absence of aluminum salt adjuvants. I see a double standard. As soon as allergic reactions were reported, officials took action. No more of that aluminum-free DTP vaccine. But today, when it is clear that aluminum adjuvants are causing a severe disabling illness, no one applies the same precautionary measure. Why is that so?
The DTP story is not at all incidental. It's extremely serious. For patients and advocacy groups, it's unbearable. First of all, Sanofi decided to falsify data. They invented adverse effects that were never reported. Secondly, the Agency of Medication, which is in charge of drug safety and issuing public health warnings, did nothing. And this, despite the fact that DTP is the only vaccine that is mandatory for children in daycare or enrolling in school. The third part of the story is probably the most serious and the most unbearable for us. When we identified the false data, established proof, and pleaded our case to the officials at the Agency of Medication and Health Ministry, nothing happened. No one reacted to it. No one at all.
I can't help but suspect the drug manufacturers of exerting pressure on French public health officials. The aluminum-free DTP costs much less than the vaccine which is on the market today. There's something else that arouses my suspicion. I doubt it's a coincidence if the vaccine is out of stock. The 3 mandatory valents, diphtheria, tetanus, and polio, which cost less than 10 valent vaccines, are not profitable. So, oddly enough, there are none in stock. That forces patients to buy vaccines that go beyond the 3 mandatory immunizations. They're much more expensive, increasing Sanofi's profits.
I think we are really up against a powerful giant. We explain that something's wrong, and they keep saying they haven't heard a thing. They claim no one has said anything. It's appalling.
The guiltiest act is that once it has been pointed out that the aluminum persists for much longer than a month, that it remains in the immune system for many years, no watchdog agency sat up and said, stop, back to the laboratory, guys. That should have been done in the early 2000s, and it was not. So we're 15 years late in terms of the natural reaction elicited by the normal application of intellectual discipline.
Before Marisol Touraine was health minister, we notified her. She even signed a letter saying that she would request non-aluminum vaccine adjuvants. But nothing has changed. Dear Mr. Lambert, thank you for contacting me about the use of aluminum adjuvant in certain vaccines. The public must have access to aluminum-free vaccines, especially due to the fact that before 2008, these vaccines were available. They even want us to believe that it is unanimously accepted that aluminum has no toxic effects. The health minister is lying. This is not unanimous opinion. The proof is that the study by professors Gherardi and Authier was published, and I reviewed it at the National Assembly in France. And it is only one of many studies worldwide. They show aluminum is a nerve toxin. How can she call that unanimity?
I think that Professor Gherardi is a very sincere and precise and immaculate neurologist. Like me, he came across these patients who develop the side effects and the macrophage myofascitis following the HBV vaccine, the hepatitis vaccine. But he did an excellent work. Like with everybody who is doing something with vaccine and does not go in the lines of the institutions, at the beginning, nobody believes him, and even may claim that he is a charlatan. And I have to say that from my experience, both in Israel as well as in Denmark, for instance, one of the countries where we have a large number of subjects who suffered severe side effects, especially from the HPV, people see these cases in which immediately after the vaccine or very close to the vaccine, healthy girls who were apparently athletic and suddenly they find themselves wheelchaired or bedridden. Another aspect is primary ovarian failure. This means that these young girls suddenly they find themselves not being able to be pregnant. And the reason is that the aluminum destroyed or affect the maturation of the eggs in the ovaries. It has been reported in several cases. It's still underreported because many of those girls are on contraceptive pills, and therefore they delay the diagnosis only after they will stop or discontinue to take these contraceptive pills. But it has been shown that if you inject aluminum into mice, you destroy or you affect the maturation of the eggs in the ovaries. We have shown it too recently, and we are going to publish these results in mice. So as you can see in summary, and I would like to emphasize, vaccines are extremely important. They have exterminate actually, or they have make our life healthier by eradicating some tremendous or awful viral infections. They most probably cut down deaths and severe complications from other viral or bacterial infection. But having said that, we have to understand that there is a group of people who are hyperactive and they are more sensitive to develop autoimmune disease.
I think it's relatively clear that there are some questions in the field of aluminium research which most would not like to see answered. Mm-hmm. I cannot sit here now and tell you, for example, that aluminium is a cause of Alzheimer's. But what I can tell you now is that aluminium does make Alzheimer's worse. Aluminium does make Alzheimer's occur at an earlier age. And it does. We know this because when we find such high levels of aluminium as we have in human brain tissue, it is inevitable that that aluminium will contribute to this disease. It is inevitable.
I can't say it's the absolute truth. There's no such thing. It has nothing to do with what I believe or do not believe. Belief is not the question. These are not superstitions. This isn't the Middle Ages anymore. What matters are facts. We collect facts. We analyze and study them. We modelize and think. And we publish our research.
Who are they trying to fool? The studies have been published. They show adverse effects, but the industry has taken over. Big Pharma has taken over. Politicians don't want to force the industry to change adjuvants. The manufacturers are used to cheap production chains. They can afford to sell the vaccine at a low price, yet they still make a healthy profit. The thing that makes me furious, that drives me to spearhead a campaign to hold the health minister accountable, is when I wonder if anyone cares about the people. Does anyone care about public health? Isn't anyone listening to all the whistleblowers? Or is money the only thing that speaks to you?
We notified the IVS, the French Disease Monitoring Agency, and the American CDC of this new disease. We notified them. We were testing the hypothesis The MMF might be caused by vaccine adjuvants. We adopted the tactics of total transparency. With the French Drug Safety Agency, the ANSM, formerly the AFSSAPS, we accepted all of their proposals. They wanted to interact with us according to a virtuous circle. In other words, we would submit experimental or clinical investigation protocols, and they would give us critical feedback on them. We'd write a new draft and resubmit. We thought that after all this discussion, which went on for years, these agencies would assist us. But we cannot help but observe that this assistance never came. There was no funding until after the AFSSAPS was dissolved, in the aftermath of the Mediator scandal, when it became the ANSM. In fact, even after the ANSM was in charge, we didn't receive our first funding package until December 2013, very late in the game. The grant was not forthcoming until the advocacy group E3M took serious action and political officials used their clout. The cooperation started to have a little more impact in terms of research funding.
We did all we could. We met with everyone. We reasoned with everyone sensibly. We cited scientific proof and facts. And yet, nothing changed. We decided the only alternative was to take physical action. We'd all go to the health ministry and say, here we are. We are the ones who are sick. We are sick. I'm so tired. It's difficult because there are children and grandchildren involved. It's not just an abstract concept. That's why we decided to hold this physical protest. 20 patients went on a hunger strike. Despite their illness, that was powerful. In the end, we made important gains. The state promised to provide 150,000 euros in financing for research into aluminum toxicity.
We became certain of the duplicity, and I must use that strong word, of our public health drug safety agencies. When the ANSM Drug Safety Agency and its president at the time, Dr. Marie-Ange, decided to set up a steering committee on aluminum adjuvant safety. It was a simple idea, and again, a virtuous one. It was to say there are many questions today requiring clinical research or fundamental research regarding aluminum adjuvants. Let's invite the country's best scientists, the ones most likely to advise us on the research agenda. The steering committee known as ALU or COPEL-ALU was set up. The first obstacle it encountered was in nominating a president. We made our wishes clear. We insisted the president be free of any conflict of interest. Yet the short list of names we were given did not meet that single criterion.
Duplicity is the right word for 3 reasons. First of all, the health ministry wanted to appoint its own chairman for the steering committee, Dr. Brigitte Autran. Brigitte Autran has a number of conflicts of interest, notably due to funding from the Bettencourt Foundation. Second, evidence of duplicity, E3M, supposed to be a member, was excluded somehow. We never received an invitation. Thirdly, the 150,000 euros we obtained after a long struggle was not to go to the most competent teams. Instead, it was slated for teams with absolutely no experience in this field. It was an insult to us. Fortunately, Lawrence Cohen, who was a senator and a member of the board at the Drug Safety Agency ANSM, intervened to make sure the 150,000 euros landed on target. With the INSERM team headed by Dr. Gherardi and Authier. I was diagnosed 11 years ago, and I still have the same pains. And the disease? The symptoms are always getting worse. The pain is always getting worse in my muscles and joints. I have tinnitus, constant headaches, and cognitive disorders always. Memory problems. I have to read every sentence several times to remember it.
It gets worse as time goes on, so far. I recently had other health problems, probably due to the MMF. Without medication, I wouldn't be able to sit here. I'd have to sit on a cushion.
My plans for my life?
It has been hard on my partner to accept the disease. When we met, I wasn't ill. He's had to accept my illness, deal with it, adapt to it. Our life together has a before and an after.
It's good to be together.
Since the age of 37, we've lived like an elderly couple. We used to enjoy outdoor activities. We had lots of pep. We'd go out dancing or hiking or biking. And now all we can do is go for a quiet stroll.
For her to be ill makes me want to be even more loyal and attentive to her. This has been a very difficult time for us. It's affected our finances. It's affected our activities. It's changed the meaning of our life.
Our plans.
Yes, all our plans.
Because French National Health does not recognize the disease MMF, the patients are on limited incomes, as low as 800 euros per month. I know people living on 500 euros a month. It is absolutely unacceptable. When we ask for what we are legally entitled to, theoretically, compensation for the damages we've suffered, we get stonewalled. We have to initiate legal proceedings, and that can take up to 7 years. In late 2012, the Council of State acknowledged the link between our disease and the aluminum in the vaccines. They have handed down 8 rulings since 2012. A strong legal precedent has been set. Yet right now, if we file a claim with the Health Ministry or ONIAM, which settles claims, we won't get compensation. Vaccination policy must not override the health concerns of victims of the vaccine. It's impossible, unacceptable.
We wanted to understand which genetic factors might explain the fact that our patients have trouble eliminating the aluminum adjuvant captured by their macrophages. First, we had to identify relevant subject matter for study. We analyzed the process whereby a macrophage ingests a particle. The macrophage behaves the same way, whether it is eating an infectious particle, a bacteria, or a particle of metal the size of a bacteria. It surrounds the intruder, bringing it inside its cell membrane. Then it develops a strategy for eliminating this toxic particle. It is eaten. The technical name for the system is autophagic xenophagy. It consists of isolating the toxin inside a double-walled sac. A sac with two membranes. That way, the alien invader is isolated. Next, the macrophage fuses with an organic killer, the lysosome. The lysosome fuses with the sac or vacuole and destroys everything inside. The lysosome contains highly destructive enzymes. They only operate at acidic pH, so it has an acidic pH. The enzymes kill living organisms like bacteria. They can also kill proteins or old mitochondria, any cellular waste material, but the pH or acidity is capable of corroding or dissolving mineral substances. To dissolve a mineral substance, you immerse it in an acidic environment, and it melts. It goes from being a solid to being a liquid. That's what usually happens to mineral particles. That's why we figured the flaw might be in the autophagy-xenophagy system. We know there are 34 genes which code for this highly complex machinery. So we looked for 109 variants. That is, genetic variations on each of these genes. They are normal. That means the mutations do not cause disease in and of themselves, but they do predispose the system to dysfunctions. Of the 109 variants we checked out, we found 7 variants located on 6 different genes, which are significantly found more frequently in patients with MMF as compared to the general public. There are international consensus guidelines indicating normal ranges. It is interesting to note that these genetic mutations are cumulative. That is, our MMF patients present more than one variation. They have 3, 4, 5, and their effects probably combine. As a result, in a normal situation, when the macrophage just performs standard duties, it works fine. If the job makes extra demands on the macrophage, most people overcome the difficulty with a struggle. But a small minority will be totally unable to secrete the enzyme, and the toxin will remain. If 10, 20, or 25 vaccines are administered, regardless of genes, everyone will be overcome by the toxic burden. The cause of the system breakdown will be the toxicity itself. I may have mentioned it in the earlier interview. In the U.S., infants receive 16 shots containing aluminum by the age of 18 months. Sources say there are between 120 and 200 vaccines being developed. What if they are tested only in relation to themselves? They say this is safe, and by itself it is. They never evaluate it combined with a half dozen or a dozen. Other vaccines also administered. If vaccine safety is evaluated only in terms of one injection, instead of in terms of the whole series, there will be many catastrophes before we track down the problem. Our research has identified a fundamental mechanism which disrupts the macrophage's ability to detoxify, so the individual is affected. That undoubtedly applies to adjuvants, because we studied the phenotypes of 365 patients, a sizable sample. 93% of them have more than one mutation, compared to only 14% in the general public. That's a big difference. Naturally, additional research is needed. It must be demonstrated that the inability to detoxify aggravates neurotoxic effects in animals, for example. It sounds easy to prove, but it will require extensive experimentation. In any case, this is the first clue I have found, providing an intelligible explanation for this difference between patients with macrophagic myofasciitis and other people who are vaccinated, whose muscles do not contain macrophagic myofasciitis, even though they receive identical vaccines. There still hasn't been any call for research that could be pertinent to this type of experiment. Currently, it does not exist. Neither the National Research Agency nor any hospital research program, none of the usual official sources for funding for research, can accept this subject. This subject is not eligible anywhere. It's frightening, but true. It means that research is no longer free to explore. It has been mapped out in advance. That makes it impossible to look beyond the themes that have been prioritized by political industrial decisions. The research has no right to exist. That's a real problem. Annual grants for the INSERM and the CNRS and the universities have melted away to almost nothing. So the potential for research into interesting subjects arising from researchers' creativity in other words, the cream of the crop of scientific creativity has been stripped of the possibility of obtaining a minimal budget to stay alive. We'll have to resuscitate it or die.